Assalamu alaikum. I am Dr. Sikandar Ali, the general and laparoscopic surgeon at KVC's Hospital, Karachi. First of all, I am thankful to you for watching my videos and giving me feedback. On the basis of the feedback given by you, I have decided to make a series of videos on the laparoscopy, and I will start with the basics. So laparoscopy is the surgical procedure in which fiber optic instruments are inserted in the abdominal cavity to permit the surgery. Okay. So first we come to the basic parts of the laparoscope. So here is the telescope, fiber optic cable and light source system, and the telescope has a distal end with the different optical axis. Generally we use 0 degree to 30 degree in the laparoscopy, but it may have different angles for the different procedures. In the proximal end there is an eyepiece to attach with the head of the camera, and there is a adapter for the light cable attachment. Internally it is an optic system for the transmission of the light and the lens system. The more the number of the lens, there's less gap for the air and more effective imaging there is. So that's important to keep in mind for the four parts of the telescope. This is fiber optic flexible light cable for the telescope. So this is the laparoscopic tower for the monitor, for the video camera system, for the light source and for the insufflator placement. So this is called the insufflator to provide the carbon dioxide for the pneumoperitoneum, and this is 3 readings for the measurement of the intra-abdominal pressure, for the gas flow rate and for the total gas consumption in the abdomen. So why the carbon dioxide for pneumoperitoneum? Because it is easily available and not combustible and absorbed and removed by respiratory system very easily. The most important one is to keep in mind that the abdominal pressure should be 12 to 15. If you exceed more than 18 or 20, it may produce complications like abdominal compartment syndrome and others. So we have 2 techniques, closed and open, for the abdominal access for the pneumoperitoneum creation. So for the closed technique, we use the Varus needle having the spring loaded system at the proximal end and the sharp and blunt tip at the and having the gas control mechanism at the one end. This is Hassan trocar for the open technique. So another important point of the angles, if you are interested in the laparoscopic surgery, you must know about 3 angles in laparoscopy. So first one is called the angle of elevation. This is called angle of elevation, and this is supposed to be abdominal cavity, and this is a target organ, and this is a laparoscopic instrument. So the angle of elevation is defined as the angle between the horizontal plane or abdominal wall and between the instrument. Okay, so this is called angle of elevation, and this must be 30 plus 30 degree at 30 to 45, ideally 30 degrees. Another important angle is the angle of azimuth. Angle of azimuth is defined as the optical axis and the direction of the instrument. The instrument and the optical axis makes the angle which is called angle of azimuth, and this is also about 30 degrees. Okay, and third one and most important one is the angle of manipulation, the angle between 2 working instruments, 2 laparoscopic instruments. Okay, and that should be about 60 degrees. Okay, so angle of manipulation, angle of azimuth and angle of elevation. So angle of manipulation is ideally should be about 60 degrees, but it may vary from the 45 to 70 degrees also. Okay, ideally it should be 60 degrees. The angle of azimuth around about 30, and angle of elevation from 30 to 45, but ideally 30 degrees. Usually 10 to 15 centimeter distance between two ports, but minimum maybe 6 to 8 centimeter. So advantages of laparoscopy are the smaller incisions, less pain, early recovery, less bleeding, reduced infection risk, and short hospital stay. Disadvantages are increased operating time, no tactile sensation, long learning curve, increased injury risk, and costly. So this was brief introduction of the laparoscopy. In upcoming videos, I will explain the instruments, handling techniques, and procedures in detail. So if you like my video, please subscribe and keep touching with me. Keep giving your feedback so that I may produce more and more videos. Thank you very much.